In the third section of visceral leishmaniasis, we will discuss different treatment options. Different treatment options available for the treatment. We have pentavalent antimonial compounds that can be used, amphotericin B, paromomycin, and miltefosine. Multiple drug therapy, and what's the prognosis of the visceral leishmaniasis after all these different treatment options tried. And then we will also discuss the treatment of leishmaniasis in immunocompromised patients. So general consideration is blood transfusion for anemia. We already discussed different features of leishmaniasis and anemia. If it's severe, we need to have a blood transfusion for patients who have very bad anemia, decreased number of red blood cells, and very low hemoglobin level. Patients need to be transfused because anemia then is causing all the shortness of breath, weakness, tiredness, fatigue, and pressure on the heart also to pump more, cause tachycardia to supply the oxygen that is required. So, blood transfusion for anemia. Pentavalent antimonial, resistant to antimony, amphotericin B, deoxycholate, or miltefosine. So we have pentavalent antimonials if there is resistance to antimony. So patients who are not responding to pentavalent antimonials, we should try amphotericin B, deoxycholate, or miltefosine. Anti-leishmanial therapy recently evolved. Relapse after 6 months usually. Pentavalent antimonial compounds, 2 pentavalent antimonial preparations. We have sodium stibogluconate 100 milligram per ml. Meglumine antimoniate 85 milligram per ml. So these are 2 pentavalent antimonial preparations used. We have sodium stibogluconate and meglumine antimoniate. Again, daily dose is 20 milligram per kilogram body by IV infusion or IM injection. Therapy continues for 28 to 30 days. Cure rate exceeds 90% in Africa, America, and most of the old world. Less than 50% in Bihar, India, as a result of resistance. So in some areas like Bihar, India, because of the resistance to antimonial drugs, the treatment is not very effective. It's less than 50%, but in some areas it's more than 90%. Adverse reaction to these antimonial compound are arthralgia, pain in the joints, myalgia, body aches, elevated serum level of aminotransferases, electrocardiographic changes like concave ST segment elevation not significant. There is also prolongation of QT to more than 0.5 seconds. So these are some changes that can occur on EKG. ventricular arrhythmia as a result of these changes, and ventricular arrhythmia can cause sudden death. Chemical pancreatitis and severe clinical pancreatitis in immunosuppressed patients. These are some adverse effects of the pentavalent antimonial compounds. Some of them are really serious, like changes in the heart, EKG, and this can cause arrhythmia, abnormal rhythm of the heart, and sudden death can occur. Amphotericin B, first-line drug case of resistance, or when initial therapy fails. So if person is resistant to antimonial compounds, then we should try amphotericin B. If not, then or if the treatment fails. Conventional amphotericin B deoxycholate 0.75 to 1 milligram per kilogram on alternate days for a total of 15 infusions. Adverse reactions include fever with chills, nausea and vomiting, thrombophlebitis, renal dysfunction and hypokalemia, hypersensitivity reaction, bone marrow suppression, and myocarditis. So adverse reactions are again serious, both with the antimonial compounds and with amphotericin B. So leishmaniasis on its own, visceral leishmaniasis, is a serious fatal condition, and different treatment options available. They have adverse effect also. So pretty hard to treat the leishmaniasis. Liposomal amphotericin B 3 milligram per kilogram daily on days 1 to 5, 14 and 21. Total dose 21 milligram per kg. Total dose requirement for different regions varies. Asia, it is 10 to 15 milligram per kilogram. Africa, 18 milligram per kilogram, and Mediterranean American regions is more than 20 milligram per kilogram. Paromomycin, aminocyclitol, aminoglycoside antibiotic. Intramuscular dose of 11 milligram of base per kilogram daily for 21 days. Cure rate of 95%. So very, very effective. Paromomycin. ADRS is hepatotoxicity, adverse reactions, reversible autotoxicity, and rare nephrotoxicity and tetany. Aminoglycosides have all these side effects. It can cause autotoxicity, hearing is affected, and hepatotoxicity, and rare nephrotoxicity. Then we have miltefosine. We have alkaline phosphocholine, half-life of 150 to 200 hours. Daily dose of 50 milligram for 28 days for patient weighing less than 25 kg. Twice daily dose of 50 milligram for 28 days for patients weighing more than 25 kg. And 2.5 milligram per kilogram for 28 days for children 2 to 11 years of age. Multi-drug therapy, combination of different drugs in India. 1 dose of liposomal amphotericin B 5 milligram per kilogram, followed by miltefosine for 7 days, paromomycin for 10 days, or both miltefosine and paromomycin for 10 days. A cure rate of more than 97%. So for a combination of drugs, all these drugs can be combined together and the cure rate is high, and even in the areas where it is very hyperendemic. In Africa, combination of SBV and paromomycin given for 17 days, safe as SBV given for 30 days. Prognosis of treated visceral leishmaniasis, recovery is quick. Within a week after start of treatment, continued clinical improvement over 6 to 12 months. A long time is required for recovery. Small percentage of patients relapse. And as we saw, the treatment with the combination drug is very effective, and it has fewer side effects as compared to the same drug which are used for alone for a longer period of time. So recovery is good, prognosis is better, patients start feeling better, but it takes about the 6 to 12 months for complete clinical recovery, and some patients usually they relapse also. In immunocompromised patients or hosts, atypical feature due to loss of immunity and involvement of unusual anatomic locations. Infiltration of the skin, oral mucosa, gastrointestinal tract, lungs, and other organs occur. Serodiagnostic tests are commonly negative. Parasites recover from unusual sites such as bronchoalveolar lavage fluid and Buffy coat. That concludes our topic of leishmaniasis. Thank you for watching sqadia.com.